Welcome to my page that is designated for people who have been in a motor vehicle accident, which is very common here in Florida. And also when I used to live in DC, it was very common there too. So anyway, often if you've been in a car accident, usually it's a, rear-ended type of situation. Most of the time people come in here with neck and or back pain. So this is just a few things to help manage those symptoms. Again, informational purposes only. This video does not substitute an actual evaluation and treatment here at Dr. D's Physical Therapy. And as always, before trying new exercise, you should consult your physician. All right, so let's get started. We are going to start with a little bit of neck range of motion. We're going to just do this very gentle 5 times in each direction. Again, with range of motion, we want to move within what is pain-free. We're not going to force our joints into positions that could be harmful. We're going to let pain be our guide. So if going all the way here is painful, let's just go half of that range of motion. Go ahead and do this with me. We're going to do 5 on each side. This is 1, 2, 3, 4, last one, 5. The next one we're going to do is side bending. Never want to bring your ear to your shoulder, your shoulder to your ear, but you want to think about bringing your ear to your shoulder and stay in that nice sagittal plane. We're not getting into rotation. You're going to stay just right to the side. So that's 1, 2, make sure you're maintaining nice tall posture. So if you're not sure, we're going to start by pulling that imaginary string at the crown of the head, stand up nice and tall. This is number 3. So being in a nice tall posture allows very safe and comfortable movement of our joints so that we're not compensating by utilizing other muscles that we shouldn't be using. Okay. All right, and the next one is going to be flexion and extension. I'm going to turn to the side. Again, start with nice tall posture. And I'm demonstrating these exercises in a kneeling position, but you can always do these sitting in a chair or even standing up. Okay, so nice tall posture. I'm going to do flexion, so I'm going to bring my chin gently to the chest. I'm not forcing anything. For extension, we're going to think about looking up and bringing the head all the way back. It's hard to talk like this. You want to avoid crunching like this. You're going to go all the way back. I think this is the third one. 4. And 5. Great. All right. Now, for the lower back, we are going to do some lumbar rotation. So for this exercise, pull this away for a little bit. We are going to lie on our backs. You can do this a couple of different ways with your arms. Sometimes I like to be, with my arms outstretched like a T. Maybe being like with cactus arms is more comfortable for you. Or maybe even just gently putting your hands on your stomach. Whatever, it really doesn't matter. But we are going to get in a nice neutral posture of the spine first. So we're going to rock the hips forward and then back. One more time each way. And then we're going to land right there in the middle. We're going to bring the knees and the feet together. We're going to rotate nice and gentle to the left. We're going to rotate nice and gentle to the right. Again, if anything feels sharp or maybe you have less range of motion, we're all working on something. You work with what you have. You're going to work within your pain-free range of motion. Okay, we're just gonna do a few more of these. When you do this on your own, you wanna try to shoot for like 10, 2 sets of 10 or 2 sets of 15. Now, the way that I count here in my office, I like to go 1, and then this is 1. This is 1 complete repetition. Some people like to go 2, 3, 4. I think you catch my drift. So you can do whatever your heart desires with that one. The next exercise we are going to do is going to be a nice stretch for the glutes, but also your lower back. We're going to start with our left leg. Again, we'll find that neutral posture. You're going to bring your knee to your chest, and ironically, this exercise is called knee to chest stretch. It depends on the person and what their mobility and flexibility are. If a person's lower back, or if your lower back is really, really cranky, you might find it more comfortable to be with your knees, with both knees up at the same time. But if you are trying to kill 2 birds with 1 stone, you can leave one leg straight and then bring the other one up. So now we're going to get a nice stretch of our glute on the left, but we are also stretching the hip flexor on the other side. But for this video, we're going to do it with both knees up, or excuse me, with 1 knee bent and then stretching the opposite side. So I'm pretty flexible here. My leg is coming all the way back, and maybe yours goes right here or right here. It doesn't matter. Everybody is working on something, and everybody has different ranges of flexibility. So you're gonna go until you feel a stretch discomfort. And if you don't feel much of a stretch like myself, I'm not gonna spend a lot of time doing something like this, because there are other ways that I can stretch my glutes. And I think you just saw me in another video where I was doing a different hip stretch, and I definitely was really tight. So again, we're all working on something, and we have to work with what we have. So I'm sorry, I'm talking so much that what I want to emphasize is you're gonna stretch 3 times on one side. Okay, so let's say we've already done 3 sets of 30 seconds on this side. Now we're gonna switch to the other side. So as you are stretching your 30 seconds, you can start thinking of all the other things you have to do today, or you can really just settle into the moment and make this more like a mindfulness time, and just focus on your breathing. But you're gonna hold it for 30 seconds, and then you'll rest, and then you'll do another 30 seconds. But again, we wanna stretch 3 times, 30 seconds on each side to improve our flexibility. So you want to roll over onto your side to get up instead of just springing up. All right, so that's all I have for this section. If you have been in a car accident, you can benefit from physical therapy. You give us a call. We can discuss all of your questions, and then we can get you on the schedule so that we can evaluate your needs and make your treatment specialized to what you need from physical therapy.